Okay, I get my signal here. Good afternoon, everybody. We are live for today's episode of the Lab Central webcast, Innovation in Biotech in Time of COVID. Thank you for joining us this afternoon. We're going to have a discussion about how we can go back to work in this time. And I have a fabulous panel joining us today. We have Katie Ray, who's the head of the Engine, an investment fund and co-working space by MIT, our neighbors here in Kendall Square. We also have Tim Rowe, the founder and CEO of the Cambridge Innovation Center, with centers here in Kendall and also around the world. Tim will give us the actual numbers, how many centers you have here, because I'm losing track of it. And last but not least, Bernat, who's the founder and CEO of one of our former Lab Central startups, Vedanta, working on microbiome therapeutics. All of us have been surprised and shocked and disrupted in our routines when in February and March the news became worse and worse every week, really, about this virus coming our way. And then I think for us it was a wake-up call when this Biogen thing happened in Boston. It brought this very near and into our circles, and it made it clear that we needed to somehow respond. And of course, three of us on this call are heads of co-working spaces, but I did want to have Bernat in here as a founder of an individual startup who had to then grapple with this. Bernat, maybe you can start by describing to us how you first responded and how you had to adapt your team's routine to this new reality and how it's been going since.
Sure. So I come from Catalonia in Spain. So we got hit there a few weeks earlier than the US. And we were primed. We've been following the news. The first action that we took was the obvious one, which was send people home until we knew better what was going on. And that's been the action, the main thing that we've done so far. I think it's around the week of March 13th. We started sending most of our employees home and left a bare bones crew to take care of the facilities and some experiments that we were wrapping up. And then we've done a few things for the few folks that stayed behind in terms of different controls to ensure their safety, and I'm sure we'll get to that later in the discussion today. But today the main tool has been just the brute, send people home until we know better what we can actually do.
Are you still able to be productive in this, and the level of man hours that you're still able to do at your facility right now?
Individually, I can be more productive than I had been in a long time, just because of actually having time to think. But as a company, it really depends on the function. The clinical activities, the clinical team, clinical operations, clinical development, they're very much used to working remotely. Some of them don't live in the Boston area. Of course, there's different degrees of disruptions in the studies that we were running, but in terms of the team staying productive, that's been largely a non-issue. All the SG&A functions I would put in the same bucket. And then we're a company that has a significant presence in terms of wet lab R&D and manufacturing operations, because we do the manufacturing in-house. And so here we've had to be a lot more careful about what needed to stay behind in terms of a really critical operation and what could wait. And there are now a number of activities that can really only be done in the lab or in the manufacturing facility that are waiting.
Tim, I saw CIC's communication were early and plentiful here, which I found a really good sign of leadership in the community. How did how did you go about with your team to devise a response for your sites, and how have you adjusted it in the weeks since we first started in March?
Thank you for the compliment, Johannes. We started by turning to our teams in Japan. That was really the first area to be affected, and we asked them to gather data about how organizations in Japan were responding. And then as Europe started to pick up, we also turned to our teams in Europe. And so we were building a plan probably 6 or 8 weeks before the COVID was seen as a real issue in the United States. And I think that was just the benefit. Many of us in the innovation field are, inherently working globally and have a lot of global connections. And I think that was a benefit that we were able to take advantage of. We imagined that certain things would sell out early. And so we kind of put a special focus on kind of ordering supplies and things that we thought would be needed. Kind of somewhat famously, I think, as you know, Johannes, we ordered 400 gallons of Purell. And we still have almost all of that because nobody's coming into the office. But we did send, as you know, about 12 gallons of that over to Lab Central. It actually goes a really long way. You only need 1 milliliter of Purell per use. And when you do the math, that's a lot. That's a lot of uses. So yeah, we tried to move quickly. I guess the one thing that I regret is the early, guidance on masks was not to use them. And so we didn't order lots of masks, and that kind of put us a little bit behind the game. If you see me looking sideways earlier, as we were preparing for this call, I'm literally texting with a manufacturer in China about 100,000 mask order. That's kind of where things are, the reality of this.
Thank you. Katie, do you think we've reached a stable situation yet, or do we still have to prepare for worsening news? Is this as bad as it gets and we're climbing out the hole from here?
There's something that I use in entrepreneurship called happy ears. My happy ears want to say yes, right? Like that's when an entrepreneur thinks like everyone's just going to fund them. Those are happy ears. My more muted ears thinks we've got a ways to go, and I don't like that. I think if there's some glimmers of hope, like I think our ERs and hospitals are kind of under control, but the recent news out of Korea or China is not great, right? We're already seeing rebounds in extremely controlled societies. And I would say certainly the US has proven not to be a controlled society. We have a president actively trying to get governors to lift bans, even though the data would not bear out that was the right thing to do. So I think we are in a extremely fluid situation, and we're going to be in a new normal for a long time, right? I think masks and everybody working from home who possibly could go on, for 18 months. I mean, you tell me, you know a lot more. When do we have a vaccine for this? And we don't know yet, really. That's nobody could put a date on that. I do think we are going to get much better at, the personal care that we have to take in terms of washing hands, wearing masks, distancing. We're going to get used to that and better at that as we see these rebounds, and then we realize like our personal actions matter. Mm-hmm. But I still think, and I struggle with this myself, thinking this is ridiculous, to wait a second, no, I've got to be super careful. And I think people are gonna have to climb in and out of those holes. And I think it won't be till the fall, when there's a big decision about schools here in the US, that we're going to sink into a different level of normal. And I don't know what the schools are going to decide. Many have already anticipated, the colleges have anticipated it will be online. I don't think the elementaries have decided yet, or the high schools. But I think that's going to push us to another level as a country. And the data is new. I think Europe is running that test right now. Thank you, Europe, for running that test. So
we will certainly learn. I know that, for example, Germany, my niece's school is back, and they do like 2 days and 3 days, and then the rest is remote, so that they can decrease the density in the classrooms. In terms of policies that we can adopt, of course, there's the ones that are handed down by the government, but I think part of our panel today is, what does going back to work look like? And for us as CEOs of our respective entities, people look to us to to put forth ideas. So I'd like to sort of get a pulse on how everybody goes about finding best practices for their business, and maybe again go back to Bernat and ask you, what are the measures that you have currently instituted at Vedanta? I know that you have clinical trials going on and critical research that needs to continue. How are you balancing the need to provide, man hours in the lab and progress with the safety of your team and following the guidelines?
Yeah, so the basic actions that we put in place beyond the sledgehammer of, almost everybody go home, have been mostly today trying to intelligently designate core staff for key operations in the facilities that can be working there with sufficient separation and in shifts. This second step of sort of designating key staff is going to become much more. It's easy for us to implement now because the density in the labs and the offices is so low. But when we start bringing more of the team, more of the R&D and manufacturing team back in, then that's going to be the more real test of the approach, right? Can you create work teams that can be physically distanced and isolated from each other, that use only their floor, that don't cross paths with the others, get people to abide to using, the same entrance and exit for their building, use designated restrooms, don't take in-person meetings in conference rooms that are not absolutely necessary. There's going to be a number of behavioral changes that need to go with these designated shifts. Something else that we've started to do, and we'll have to do a lot more of when we have a bigger part of the team return, are just general administrative actions with the goal of reducing the density of people in the office and maintaining the social distancing. So for example, and I had mentioned limiting use of conference rooms before, or spreading people out by rearranging desks and chairs, shifting schedules. Everybody coming into the office has to take a health survey, self-administers themselves, a temperature test. So a lot of those are already in place, but will be really tested when more of the people come back. We've done the easy, quote unquote, easy stuff with PPE, just making sure that we have some of the basic supplies of masks, of gloves, of disinfectant. And then the next step for us that's going to be, I would say perhaps the most important, because we haven't really fully implemented that yet, is the more building level engineering changes. So not so much administrative, but really looking at, what are the specifics of our building in terms of belt ventilation, filtration, what can we do with portable air purifiers, whatever the building infrastructure doesn't get to, enhance disinfection protocols when there's more people and inevitably there's the first positive, etc. So a number of the things that we need to do on the return, we're already doing. We'll just have to do them at a different scale and much more intensively when we come back, when more of us come back. I don't imagine anywhere near to all of us coming back, and it's not really necessary. I think most of clinical and SG&A can stay put at home, but when more of the R&D and manufacturing folks return.
Yeah, so for us in the biotech field, we've really never fully shut off. Things are going on and have gone on in your lab as well as in ours. But for the CIC, Tim, you had pretty much closed your facilities, I think, and you're now in the process of reopening them carefully. Can you walk us through, maybe start with policy? Start with the rules and regulation that you've put in place and why. I think it's so important that we strike a reasonable balance between the craziness of ignoring the guidance and overly restrictive policies that make everybody non-productive. So where have you landed so far at CIC?
Sure. Yeah, our office facilities have been closed for what we call normal business. We've had a couple dozen companies that are doing COVID response work that have been welcome to come in, but for the most part, we have been closed. As we're preparing to do broad openings, we actually did that already this Monday in Rhode Island, and it's going to be next Monday in Massachusetts and onward in other states and countries. We also kind of reopened in the Netherlands. So this is all very real time. The steps that we're taking, I think at the highest level, they're not that different from what you're reading in the papers, what Massachusetts is looking for. So everyone's got to wear masks all the time, except when you're alone in an office. If you're in a multi-person office, you should have that 6-foot spacing, and we are still recommending the masks. We're not going to police it for our private clients in their private offices if they choose to do something different in their own private office. But in the common areas, we will throw you out if you're not wearing a mask. And so we plan to police that very intensively. We're going to use the same approach that Boston Medical Center does, which is they have what they call secret shoppers, people whose job is to go around and they're both tabulating statistics like how close to 100% is mask usage in common areas. If they see someone who is not using it correctly, then they're going to let them know. And if we have a persistent offender, we're going to ask them not to come into the office. So we're taking that very seriously. The second thing we're doing is touchless ness. So we're basically looking at all places that multiple people would touch with their hands and finding another alternative. It's surprising how creative you can get with that. There are a lot of ways to avoid touching things with your hands. You can have an elbow-based, hook on the door. You can have a powered ADA compliant door where there's a button you kind of hit with your elbow. There are these things called foot pulls that you can screw into doors that allow you to open a door with your foot. So we're using, and there are some doors you'll discover, why did we even have that door, right? So as you go into bathrooms, the multi-stall bathrooms, if you've ever been to a bathroom in the airport, there's no door, right? You just walk right in. Why do we have them in our offices? So walking through every surface that you might need to touch, that other people also touch, coming up with a solution for that surface. It might be as simple as the coffee machine having disinfectant wipes there. So you just disinfect it, after the last use, and you're on to, you get your coffee. The third thing that we're doing is self-checking of symptoms. And the way we're approaching it, and there are a lot of different ways groups are approaching this, we're approaching it as a home-based self-check in the morning. So temperature, by the way, is the most common symptom of COVID. It unfortunately isn't 100%. It's something like 50% or something like that, depending on stage and whatnot that you look at. 56% is a number I've seen. But it is the most common symptom. We're checking that and a whole long list of other symptoms. We're asking people to fill out a form at home. We're not storing the results of that form. We're simply storing whether or not they filled it out. So at our current stage is to enforce that you did it, but it's an honor system that you're telling the truth. It's an honor system what you do with the data. It may be that at some point we move to something more stringent, like checking in the lobbies, but this is where we are right now. We're trusting our people. We're trusting our people to tell us the truth. We're not trusting them to remember to do this every morning. So we're getting into their face a little bit, making sure they really remember to do this and 100% of the time do it. Initially, we're just asking people if they've done it. We're going to tie it with our key system so that if you haven't filled out the form, your key doesn't work. That's going to be a little bit down the line as we get people used to this. So those are the big three. It's the masks, it's the touchless ness, and it's the self-checking at home. There are a host of other things that we think are important. The biggest one that isn't here yet, that none of us can quite do yet, but we think will be key, is testing. And so what we're aiming for, we don't know if this is going to be technically and economically feasible or how soon it will be, is pooled testing at the door. What we'd like to see is everyone doing a saliva test at least every few days, ideally every day. As you know, pooled testing in theory would allow us to get up to maybe 64 samples in one cup, as it were. And then they test that cup. If anybody's sick, then they test everyone in that pool to see who it was. But this is a cost-effective way that you could get hundreds and hundreds of tests done every day. And we're hoping that that will be a path that allows us to really identify people that may have contracted COVID and help them get care and not infect their coworkers. We think that could be a game changer.
I would agree. I think if we had the ability to rapidly and affordably test everybody, we've been thinking about doing a system where we test everybody as they come in the door, like you're doing at the airport security. You go through the thing and no one carries a knife or a gun, that side of it, so no one would be carrying a virus in our facilities. It's still, reality is still hard in terms of affordability and turnaround time, because you can't make people wait for 4 hours for a PCR test to read out. Right. We're looking at various tests, and I know that Katie has a company that also uses Lab Central, and we had Irene on this show like a week ago or two. Irene Bosch from E25 Bio, they're developing a test that's a rapid test. I don't know if it's going to help with this question, but Katie, are you looking at, hopefully, are you looking at other technical solutions? Tim mentioned sort of the door handles and things. Like, what other technical solutions are there that we could use in co-working spaces like ours? You're on mute.
Sorry. There's one that's really simple and kind of old school, which is how do these teams function and work together? I think one of the hardest parts about co-working is people are going to have different anxiety levels about what other people are doing around them. And so how we work that out as a group of companies, I think, is the trickiest part here for what we do. And I mean, that goes inside any single company. People have very different views of what has to happen. So I think we as co-working leaders have to kind of set what we think the right norms are and be ahead of the curve on that. But maybe more importantly is work with everybody inside in terms of how we're going to socially distance, how we're going to time shift, how we're going to work out, people's concerns in public in front of everybody so that everybody's a part of that conversation. Because I think that's the real leadership here, is like, none of us have all the answers and we are learning very, very rapidly, right? But we're going to continue to learn through this whole process. And how do you share that with each other and gain enough comfort from the group? I would say one other technical solution we haven't mentioned is how do you trace, right? So if somebody does get sick, which is very likely going to happen in every workplace, how do you trace back who they've seen, who they've been in close contact with? We're looking at how do you do things like that as well. And, we don't have a governmental solution. So we're all kind of using these homemade solutions. E25 Bio is working on a rapid diagnostic test, like a pregnancy test, where you know in 5 minutes if you had the virus. Obviously we want that on market as soon as possible, but there are processes that companies have to go through even when the government speeds these things up. So I'll let you know as soon as we know, and certainly if it were possible, we would use that immediately. The antibody test is also important, but we don't know a lot about that. Is this morphing? Is it really going to tell you? You can't get it again. We just don't have solutions there yet. And so again, I think the leadership comes in explaining what we know now, learning rapidly, explaining that what we might have known a month ago is wrong, and continuing to learn together. So that's what we're concentrating on.
Thank you. The ongoing uncertainty about what this means, I think, weighs on people's minds pretty badly. And we've had teams in here who say, or whose CEOs say their employees are, they feel unsafe and they don't want to come to work. So I think it has a lot of our role has to be to communicate information and to come up with policies that allow people to be at ease while they are coming to work. Bernat, in your team, do you have these challenges? I mean, people might be living with their elderly parents or with an immunocompromised loved one, and while they might not have concern for themselves, they just might be uncomfortable coming to work. Have you seen such questions, and are there ways that you're using to address that?
Yeah, there's a lot of personal circumstances. The person that volunteers at a nursing home, that lives with the elderly parents, folks that used to use public transportation to get to the office, many of us that are in a childcare limbo situation, which I think is the biggest one of all in terms of how many people it hits. And then, as you and I think Katie already noted, there's different degrees of anxiety about the same situation. So I agree with what you said. You know, there's a part that we can do in leadership to show competence, that we're thinking about some of the key elements of keeping a safe workforce in terms of, you know, things that we can do administratively in the controls of our buildings, with supplying PPE, with the appropriate training. And that sort of, you know, hopefully creates a general environment where most people feel like, you know, the group knows what they're doing. But then if you have a team big enough, there's always going to be a few people that have a very different level of comfort with the situation. And then I think that's where we're going to have to look into individual accommodations for specific people's circumstances. And our HR lead, Jack, is going to be very busy, I'm sure. You know, I think that we'll have to think about reasonable accommodations for, you know, if a person just doesn't feel comfortable coming to the office or coming to the office in the conditions that currently exist, then what are accommodations that we can make to address that, or to find a way for their work to be done remotely, if those are possible. For people that were using public transportation to get to the office, how do we help them find an alternative to get there that makes them feel safe and the people that they work with safe? And the toughest one is the schools. That one is tricky. I mean, I think the last I heard is schools are closed through the rest of the year until June 29th. Daycares likely won't reopen until then. So it will be difficult for many to manage childcare. So that I think is going to be the hardest thing to navigate.
And employers will have to be very flexible to accommodate their parents who now have to do double duty as a home teacher or nursery care provider. Yeah, for sure. We're coming up on the hour, and I see a number of questions already coming in from the audience, and some are sort of technical in nature. I think one question that is still important in the setting of co-working is the many different users that come on site and the risk of door handles, and like how likely am I to get infected from touching somebody else's door handle? I know, Tim, you've done a lot of research around that. What's your guidance for CIC, and how does that influence your policies on site? No, you're on mute every time.
I have to apologize, Johannes. I would hold this to the screen. My except it doesn't show on the thing. I just got the FDA certification from the mask company in China that we're juggling with. Could you restate the question? I'm so sorry.
So I'm asking, people are worried about infecting themselves from surfaces, right? And especially in a place like CIC or Lab Central, where we have hundreds of people potentially coming through. Am I at risk? Should I even, should I sit in that conference room that another person has used an hour earlier? What is the risk level, and how are you communicating that?
So I'm not a doctor or a public health official. Katie would remind me to say that at the beginning of this answer. But if in our safety plan that we have, it's actually on our website. If you go to cic.com/COVID-19, you can look at the copy. We cite a lot of research on this topic. So there's a study out of San Jose, I believe, UC San Jose, that points that there's actually no credible science at the moment that points to someone having actually contracted COVID from touch. They're not saying that there's evidence that you can't contract it from touch. They're just saying that there aren't any studies yet that have actually found that to be the case. There's some stuff going around the internet which is incorrect about this, that isn't actually backed up by any studies that suggest it is. We think you need to take touch seriously, and we are. That's why we're going touchless. And we've actually ordered these kind of cool little tools from China you can use to like push elevator buttons and things without touching them. But in the hierarchy of concerns about what you need to focus on, the CDC is now focusing on really just one thing. It's person-to-person contraction of COVID as a result of close contact for what they call a prolonged period of time. So they're really saying there's one thing you really need to focus on, and that's you being with an infected person within the 6-foot radius for what they're now saying is somewhere between 10 and 30 minutes minimum. The Partners in Health is using a 15-minute standard. Now, I'm not a public health expert, and what we say is, look, we're reading studies as they come out every day, and we're going to keep revising our plans as we learn more. So we're not trying to say, we have the answer and this is it. We're trying to say, this is what we know today. And so as a business, as you focus your efforts, this is something you want to particularly focus your efforts on. What they are saying is that, sure, the virus is on surfaces. It can be found there. There are lots of good studies that say that. They're also saying that the virus does linger in the air. There are studies that have tested that and found that to be the case. What they're not saying is that they've found cases where people were infected that way. Now, there are some cases where they're not sure how they're infected. So maybe that's that is a factor. But if you look at the real world studies, there was a great study done in South Korea, and it's referenced at the top of our safety plan if you read it, that the CDC republished because they thought it was also very relevant, where they look at a case where 97 people in an office building got sick, and almost everyone who got sick was in one room together. They worked in that room. Those are their coworkers. So it appears that your biggest risk is in fact not the person you walk by on the street, not the person you share the elevator with, not the person that was 6 feet away from you getting coffee before you got coffee. It's the person you sit next to in your office. And so understanding that that's the current latest thinking about where the threats lie, that can inform all of us who are trying to make our spaces safer what to focus on.
And to clarify, that was without mask policies in place.
And
right?
that Korean example, they didn't have masks. This was before masks were recommended. What the masks are believed to do is really three things, right? The first is maybe they will block sort of droplets from somebody else that are already floating in the air. That's a little bit in debate. The cheaper masks maybe don't do that very well. The really good N95s do that very well, according to the studies, but we're not really wearing those in office contexts, right? The second thing is they make it harder for us to touch our nose and mouth. So if there is virus on surfaces and we touch a door handle and then we kind of scratch our nose or something, which apparently we're monkeys and we do that 25 times an hour or something, the mask will keep you from doing that. So it kind of keeps you healthier that way, perhaps, if surfaces do matter. But the third thing, which is probably the biggest impact of masks, is what they call source control. We don't know if we're asymptomatic carriers of COVID ourselves. That's what the definition of asymptomatic is, right? We don't know. So, at any given day we walk into the office, we may be the vector bringing the virus into the office. The mask is believed to slow down the droplets. Even if it's kind of a homemade mask, it slows down the droplets. So instead of going 2 meters out, maybe it only goes half a meter out. Maybe it gets caught in the mask and the volume goes down. So that's what's believed about this. There are a variety of studies that have looked at, how effective masks are. For instance, Nature Medicine has an article looking at surgical masks, which are the relatively cheap ones with a little wire band that are actually relatively comfortable. Those, by the way, latest news, you can buy them in volume from China at 26 cents now. The pre-COVID, pre-pandemic price, I think, Johannes, you told me was about 10 cents for one of those. So it's not that much. Sorry?
2.5.
2.5 cents? Okay. Well, so it's more expensive, but not out of reach. Those masks, according to Nature Medicine in their study, and they were looking at a previous coronavirus, so not this coronavirus, but the same family, they did block 100% of the droplets that were coming out of a person with the virus into that environment. Now, so whether it's 100% or some other number, it's certainly cutting down on it. And since we now know that it's sort of exposure to quantities of the virus over time, what they call viral load, we believe that these masks will significantly cut down on the viral load for those around us, and hence the focus on masks. So
we have to have so many questions, so we have to move fast through them. We have a lot of audience questions. One that is in line with what we've just discussed is, are gloves playing a role in your reopening strategies, and are they effective, or are they even permitted? Quick answer.
No, not effective. They are not even permitted in some areas. The reason is that your glove is also a vector. If you get virus on your glove and then you touch something, you're still spreading it, and gloves tend to be harder to clean. If they're nitrile gloves and you're cleaning them with gel just like you would your hand, they're okay. But often they're not permitted around labs, because then people think you're carrying other contagion potentially from the lab out into the common areas.
Yeah, we would have a similar guidance, and we would forbid wearing gloves in the common areas, because it makes people pay less attention. A question that is for Bernat: how are you dealing with training new employees where there's likely to be closer contact needed than in the general work environment? Have you even onboarded anybody now, or are you planning to?
We haven't onboarded anybody on the last 60 whatever days since COVID started. So
and so that's bad for anybody who's looking for a job then at Vedanta.
What was that?
And that's probably bad for anybody looking for a job with you in the near term.
It will happen soon, but it hasn't.
Yeah, and then eventually you'll need to train these people, right? You can't probably do all of this remotely. So how are you going about it?
I don't know. I guess the HR stuff will be the easy, but the lab trainings are gonna have to wait.
It's not straightforward. Katie, what conditions will need to be met before in-person visits by vendors will be allowed to resume at the engine? Currently, you're not admitting visitors, right? You're not admitting vendors. Will you ever?
Yes, we will, of course. I think it's on hold until we have a much better idea of how we can get people working at the engine back to full capacity. Then we'll tackle that at that point. Our suggestion is people take these meetings outside of the engine. There are plenty of places that eventually will be open that are quite close, that they could sit outside or whatever and take a meeting.
Yeah.
And we're thinking of seeing if we should set up an area for the summer in like a tent format somewhere on our property. So, but no, we have no real answers on that yet, which is unfortunate.
Tim, here's a question for you, dealing with a large population. Since it will happen, what will you do when one of your employees, or I extend any of your residents on site, tests positive for active disease? Will all their contacts be quarantined? Will you have to do a full cleaning? What's your protocol?
So the broad answer is yes to all of those things. The cleaning protocol, it's also actually listed in our plan, which you're welcome to read, is that, first of all, we get the data. How long ago was this person infected? Sometimes you hear 3 weeks ago. Well, then we're past the 14-day quarantine period, so it's moot at that point. So you get all of the data, make sure you really have it and understand where they were. We then go to the key cards and the video to find exactly where they went within our spaces and who they came into contact with. We follow the Partners in Health guidelines on that. So we're looking for people they spent 15 minutes or more with in common spaces. Within their private office, that it's their business to try to identify who they might have spent time with. We don't have cameras there, we don't know. We close all the areas they actually went. So we're not necessarily closing a full floor at this point, because the current view is that this is not lingering in the air in a way that infects people. But we close the areas that they went and we disinfect those areas. We've actually had our cleaning crews acquire the equipment to do the disinfection themselves. So like without getting an outside special firm, so that we can do it in some cases immediately. And if we can disinfect immediately, then we don't have to have that longer delay. Usually, by the way, you hear about these infections well after they happened. And so the protocols are a little bit different when you hear that something happened a week or two ago. But we'll still, if it's within the 14-day period, we disinfect. We also preemptively disinfect every weekend. So if we hear on Tuesday that somebody on Friday was in our office and had COVID, we're actually okay because we already disinfected either Saturday or Sunday. And so we do that to stay ahead of the game, and because we don't know when we're going to hear what. Within the company, we do our own contact tracing using our video and keycard records. We encourage the person to participate in the statewide contact tracing efforts, which are usually very good. And they have teams of people who will follow what you did outside the office and contact those people. Obviously, that's beyond our scope.
I think this may have to become our last question. We had 3 minutes. So Katie, and I apologize if it's a general question, but it's asked of us by the audience. What are your best estimates for realistic reopening timelines? And of course, that means sort of the general. You touched on the schools. Do you think a fall resurgence is inevitable?
I don't know. Again, I thought the data out of China and South Korea recently was not great news. That does point to a fall resurgence for us. I think we will start seeing more and more people go back June, July, August, September. I think people should be well prepared for a retreat back to, at home time. And I think that's what I keep saying to my team and everybody, like, get used to this, get used to having to go back to this mode, get comfortable equipment so you can work from home easily, anything that will allow you to work from home will make your business more resilient. So I think that's what we should be preparing to do rather than focusing on the date, because we have just very little control there.
Yeah, I agree. And for those in Massachusetts, the governor issued yesterday a somewhat vague, but at least it introduces this concept of we may be going forward and back, depending on what the transmission data tells us. And so we all have to be prepared after maybe a phase of relaxing standards in the near future to then go back if the transmission rates increase again.
But Johannes, I think all of us keeping stats on number of people in our building, how many transmissions, like the more that data is out there for our public health officials to eventually use, the more we will be able to, have an understanding of what really needs to happen. I mean, we know in these like meatpacking plants, that's a really tough place to keep open continuously. But I think in some of our work environments that we're in, we may do a relatively good job of keeping our counts very, very low of transmission. And if that's the case, then I think rationally, it's not one size fits all, everybody's home, everybody's at work, right? We need to show that we as co-working can do a great job of keeping transmission low. Then we'll probably be the first in the list to reopen. And so I think the more that data is there, I think it'll be really important. And I know we're all keeping this data, and I'm sure many of our startups that are doing well and have the capacity to do that.
I'm constantly heartened by the facts and the new ideas that our startups bring forward and solutions. I've talked with a group at MIT that has developed this rapid test based on CRISPR that we're going to trial here. And I hope that I'm actually very confident that we in Boston, our community of healthcare researchers, will come up with really meaningful solutions that will get us out of this. With that, we want to wrap this up. I'm grateful for all three of you for joining us this afternoon. It's been fun. Tim, good luck with your shipment. Maybe you can give us a few of your masks.
We've been half on.
Bernat and Katie and Tim, thank you so much for joining us. Thanks to the audience and Megan and Eliza for keeping the engine running in the background. Please join us next week. We will have a similarly intriguing panel of experts in the public health area, where we're going to look at the big picture and hope to get some of their ideas shared with us. Thank you, and see you again next week.
Thanks.
Take care.
Bye-bye.